Welcome to the Texas Tech University Health Sciences Center Department of Obstetrics and Gynecology. Here, our physicians and staff pay careful attention to our roles in the education of medical students and residents, research in women's health and reproduction, and the delivery of patient care to women.
To be able to take care of people's lives that are different than yours, and to understand where those patients are coming from, and to try to offer them care in a way that is unique to them and unique to their experiences is important.
I saw the great pathology that the residents were handling here and how well trained they were in handling high-risk pregnancies, and I knew I wanted that type of training and confidence when I was out and graduated.
From day one, we're kind of thrown in and told to swim. It was really surprising to me how quickly I was expected to, doctor. So it's been a really steep learning curve, but it's been a really good learning curve.
The TTU HSC Amarillo OBGYN program is fully accredited and approved for 12 residents, or 3 per year. Due to its small size, our residency experience is highly personalized. Faculty encourages and supports each resident to pursue his or her special interests and career goals, in addition to the fundamentals of OBGYN.
The most important thing, in my opinion, is that it's a very small program. There's only 3 a year, and that allows for some really individualized learning plans and very one-on-one instruction with faculty that really know the skill set of the resident. And it's somebody that you're going to work with every day, and they're going to see that skill set get better, and they're going to help you in a formative way early in your career so you become the surgeon and the OBGYN we hope that you can become.
Coming into academics from private practice, I didn't know what to expect. I think that I've really enjoyed teaching the residents and interacting with the residents and helping them kind of learn what it's like, especially when you get out into practice and the basics and the things that weren't taught to me. And I think that's actually been one of my favorite things that I've gotten to do. All the while, I've really enjoyed teaching them surgically, and I like running labor and delivery too with decision making and helping them make the proper decisions in a very high-stress situation sometimes.
One of the things that I think is a good advantage to this program is it's just the residents and the faculty, and there's no fellows here. So I think in terms of surgical experience, that helps. We have 2 GYN oncologists in town, one that we rotate with directly, but both are very involved in our teaching. We can always scrub in with them. In any other program that, if you had a lot of fellows, you'd probably just be watching. We're first assisting them.
We don't have a ton of subspecialty exposure, but we're the only surgical residency on this campus. So my residents often scrub with the breast surgeons and the bariatric surgeons and the general surgeons, the urologists. So they get the best of all the worlds because there's no other surgical residents. So they can go do cases with urology and get just a top-notch training from the urologist, and that translates into them being able to do, urogen procedures later in their life.
As the Texas Panhandle area is largely rural, our medical center is a hub for 5 surrounding states: Texas, New Mexico, Oklahoma, Kansas, and Colorado. Northwest Texas Hospital serves as a high-risk referral center for this vast region and provides helicopter transport and a state-of-the-art neonatal intensive care service. The affiliation agreement between TTU HSC and Northwest Texas Healthcare System provides a partnership in the development of high standards in medical care through education, service, and research. BSA is a private, nonprofit institution that supports our private gynecologic surgery experience and gynecologic oncology service. Our family medicine program uses this hospital as its primary teaching facility, and our department serves that department in a consultant capacity. Harrington Cancer Center offers care and assistance to our OBGYN program.
In between Oklahoma City and Dallas, we're the medical center that covers this whole big area in the Panhandle, and not just Texas, but even parts of Kansas.
Both hospitals have recently upgraded labor and delivery. At Northwest, we've gotten 2 brand new ORs this year. There's 4 robots in the town. We have an FLS trainer that the dean purchased for us this year. Here on the campus, there's ultrasound curriculum and ultrasound trainers that are top-notch.
One of the things that's the most surprising to me is the fact that we have such diversity in our patient population here. I really did not expect that we would have a large group of Somalian refugees as well as Burmese refugees. And there's a number of different challenges that we face every day with caring for those patients that I've found really rewarding.
My first month was in labor and delivery, and I was floored. We've had some crazy things come in, and just some high risk, some abnormalities, things that you don't get to see very often, I saw within my first week. And we're able to learn how to treat that, learn how to care for that, and that in the end just kind of expands our knowledge. So that's just been amazing to see.
It's almost like the United Nations over there at the hospital, and there's lots of different cultures over there every day, different languages, different approaches, and it really adds to the breadth of the knowledge base that obstetrically that these residents leave with. I would put them up against any resident graduating from any program for the amount per resident that they're seeing of high-risk obstetrics.
While Amarillo has all a bigger city has to offer, it still has a small town feel. It's easy to get around, there's no major rush hour, and there's a good chance you'll run into a neighbor at the grocery store. Amarillo's economy is diverse, and it's home to one of the lowest unemployment rates in the state. Amarillo is a great place to live and raise a family.
I came up here for my last 2 years, and I'd never really been here except passing through on occasion, and actually, I liked it, and as did a lot of my friends in other specialties that have come back. And in the meantime, I met my wife in my last year and then decided to stay for residency. And the thing about Amarillo, I think, now that I've gotten older, I have 2 children, is it's a great place to raise children. There's plenty to do. I think it's a great community.
I am surprised by Amarillo. I grew up in a one-stoplight town as a child and went to med school in a pretty college town, smaller college town. So I'm used to a rural area, but Amarillo has more than surprised me in what all we have here.
Sometimes I worry that people look at our program and think, well, they're looking for married with children. And we're not looking for any type of resident. We're looking for the best residents we can get. But what often happens is people look for us, and that's often people who really appreciate work-life balance. So as an example, I have 4 small children, and I just had lunch with them, and then I'm back at the hospital within 10 minutes and able to work a full schedule, have a good research portfolio, do all the things I want to do in my career, but yet get home and see my kids and participate in their life.
You never know what you're looking for until you kind of get there and realize, wow, this is the fit for me. Going into residency, there's a lot of things. It's a steep learning curve that you need to go up. So anytime you kind of have residents that are willing to help you up that, it's not that they're going to take the curve away, but to kind of help you up that, give you some of the things that they struggled with, and then kind of make your journey easier, it makes it even better.
The residents here are just so nice. They have accepted us with open arms. We're all just really supportive of each other, and it's been great.
We all leave our families back home, and you have to go to a place where you can find a family. And I've really found that here at Texas Tech in Amarillo.
For more information on our program, we invite you to visit our website.